Have the pleasure this morning of introducing our panelists, and I would like to ask them to go ahead and stand and come on up here. While they're coming on up, I'm going to first introduce Heidi Alessi. She's a partner at K&L Gates and partner in their benefits, employee stock option plan, and executive compensation group. And your eyes are going to glaze over when you hear about her expertise here. She advises employers on tax-qualified, non-qualified, deferred compensation, equity compensation, health, wellness, and cafeteria plans, including compliance with all federal regulations. Did you get that? Obviously, she has some amazing expertise. We're delighted to have you, Heidi. And in fact, she's kind of a glutton for punishment because, Heidi, how many times have you been here at GSI?
I think this is the fourth time.
Fourth time.
Some of you have heard from me before.
So thank you, Heidi, for joining us. We also have here Kelly, who you got to see just a few minutes ago. Kelly Sanford is the Vice President of Market Development in the East and Central Markets for Group Health. And hopefully most of you are familiar with Group Health. They're one of the nation's largest consumer-based healthcare systems. And she is facilitating regional strategic decision-making, articulating the organizational strategies, and identifying shared goals of the delivery system for the health plan division. And on top of that, I don't know if you clone yourself, but you are also president of a provider group, is that right?
I am, yes.
So, and you're doing both these roles at the same time?
I am. Lots of hats. Yeah.
Lots of hats. Wow, okay. And somehow you found time to share your expertise this morning. Okay. We also have, welcome to Kelly. We also have Linda. And Linda is the Director of Sales and Account Management for Delta Dental of Washington. She's been in the healthcare industry for 37 years, including 14 years at Delta, and the last 7 years in her current position as the Director of Sales and Account Management. She is responsible for all new sales, implementations of new business, and contract renewals and negotiations. And you also represent dental with anything to do with the national health exchanges, right? Yeah. Fantastic. Well, welcome, Linda. And I'll go ahead and save her future embarrassment. Linda is being a true sport this morning. She is a substitute for our original panelist. So she said, Anthony, go easy on me today. So if you see me teasing or torturing poor Linda, you'll know why. So. All right, last bio, and then we'll get right to it here. We're also very pleased to have Nellie. Nellie Kinsella is the Communications Associate for the Washington Health Benefit Exchange, and she's been part of quite the whirlwind, an organization that did not exist a year ago. She is in this role providing program and policy support to the user interface design of the Health Plan Finder and the Navigator in-person assistance program. And she serves as a liaison to public stakeholders, consumers, consultants, and before that, she was part of the project team planning all this with the healthcare authority. Is that right? Fantastic. All right, well, could you all help me join giving a warm welcome to our panel? All right, so we're going to start off with just a few audience polls, and you have to indulge me because I am the president of a health foundation, and one of the core principles is you got to stay active. So if I could ask everyone to please stand up. Stay standing if you are part of an organization that is 1 to 50 people in size. Please stay standing if you are part of an organization between 1 and 50. Okay, about half. All right, now please stand if you are between 50 and 500. If your company, your nonprofit, your agency is between 50 and 500. Okay. Wow, almost the other half. And then if you, please stand if you're larger, your organization is, that you work for is larger than 500. Oh, wow. Okay.
Yeah.
Very cool. All right. Now, everyone stand up again. Hey, it's all about getting that blood pumping this morning. Okay. Now, hard to believe it's 2014. Think back through, let's say 2010, so last 3, maybe 4 years or so. If someone in your company, or if you're part of a really large company, maybe your department or your division, think back, and if there's someone that you know where they or their family member had a serious health issue. Maybe there was a daughter that had a broken leg at gymnastics, maybe a friend that you work with that had a spouse that had a cancer scare. Please stay standing if you can think of someone that you work with or that you, or your own family or that you know that had a serious health incident in the last, say, 3 or 4 years. Please stay standing. Virtually everyone. So what do you think? Is our topic this morning important? Yeah, absolutely. Fantastic. All right. We're almost done with our polls here. Thanks for indulging me. All right. Please stay standing if you have been part of an analysis or are a decision maker about what types of benefits that your organization offers its employees. Please keep standing if you're either part of the analysis or have been part of the decision making. Oh, quite a few. A lot more than I expected. Okay, fantastic. All right, last one. Stand up, please. All right. Please keep standing if throughout the rest of this panel you plan on texting, checking your email, or the last night's NBA scores. No, obviously I'm just kidding. Before you sit down, go ahead and either a person at your table that you haven't met yet or a person at the table next to you, go ahead and introduce yourself very quickly and then please have a seat.
Yeah. Thank you.
Going to Catholic Mass service. This was always my favorite part of Mass.
Yeah, exactly.
Please give peace to someone next to you.
Yes, peace be with you.
Great, thank you everybody. Please have a seat. All right, let's get started here. So, my first question this morning is for Heidi. Heidi, we've seen some pretty significant headlines here this past couple of weeks. Tell us a little bit about what's been going on and what the heck should we be taking away from these big headlines?
Yeah. Anthony told me he was going to put me on the firing squad first, so let me tell you, don't shoot the messenger. Actually, we have some sort of good news this week. Last week I was thinking, there's not going to be much new to talk about this week. And then Monday arrived in my inbox, 200 new pages of regulations. I thought, oh gosh, I have to read those. And I did read all of them. They're about this thick, but I haven't memorized them yet, so forgive me. But the big news is that, well, first of all, to make sure we're all on the same page, you probably have heard about this thing called the employer mandate, where if you don't offer coverage to all your full-time employees, first if you're large, more on that, you'll be subject to one of two penalties. So we have some new guidance that says if you're, originally the mandate applied to everyone who has 50 or more full-time equivalents, not full-time employees, but it's a look back to the prior past year to average whether or not you're a large employer in the next year. So that applied to 50, and the regulations came out on Monday and said, we're going to give you a little breathing room if you're between 50 and 100. So if you're over 100 employees, you have to provide healthcare coverage to everyone beginning in 2015, but if you're between 50 and 100, you get until 2016. So that was somewhat good news, a little bit of relief. They also then changed the rules on how we calculate if you're 50 or more, because that is a cusp that when we asked the regulators when the law first came out, we asked a lot about, well, what if you're close to 50? How do you calculate that? What if you don't know that you're 50 because it's based on the prior year and at the end of the year you're still, things are working out and you really don't know how to count it yet because it's not as simple as counting bodies. There's some math that goes into it. And they said two things, that if you are close to 50 for the first time, you can look back to the prior 6 months rather than the prior year. Your math is a little easier that way. And then the other thing they did is if you're close to that 50, and you need to wait to that last quarter to count how many employees that you have, you won't be subject to a penalty as long as you provide the coverage by the following April 1st. So again, a little more wiggle room there. The other new change was the employer mandate requires you to offer coverage not just to your employees, but their dependents, children, not spouses. And they put that on hold too, and that was kind of puzzling to me because one of the big reasons for the law is that there are a lot of uninsured children, and I don't know too many health plans that don't include dependents anyways. So for whatever reason, they did that. A lot of other stuff we could go into about how you calculate who's full-time, whether you're seasonal, variable hour, sort of similar to prior rules we talked about, sort of different. A lot of math goes into that as well.
Great. Well, at least we've got the preview here on what's happening on the headlines, but I will be asking about some of those wonderful calculations, and about 90% of the audience, their eyes will glaze over.
Yes.
But that's okay. For 10% of you, you'll be like, really? Okay. But you raised a really great point, Heidi. Nellie, talk to us a little bit about the health benefit exchange, and with folks, especially smaller-based employers, not having some of these provisions come online. Why should folks in the audience perhaps care about the health benefit, the health plan finder?
So can you all hear me all right? All right. So as of October 1st, we have our Washington Health Plan Finder, which is the new health insurance marketplace for residents in Washington to access free and low-cost health insurance. So you might have heard about it. You might have visited. If I can take the liberty to do a poll too, how many folks have visited wahealthplanfinder.org? All right. That's great. So we've had over 1 million hits to our website, unique visitors, since October 1st. And, I think all of us, right, know someone who needs to access healthcare benefits, whether, if we get it through our employer, maybe we have dependents who aren't covered. Maybe we have family members, friends, right, who can really benefit from these new free and low-cost options. The affordability kind of scale now goes up to $94,000 for a family of 4. So we have this continuum, right, where we've got Washington Apple Health for kind of our lower income, right, all the way up to this, middle class income who can access the tax credits. The tax credits reduce the monthly premium costs of health insurance, and in some cases even reduce out-of-pocket cost-sharing amounts. So plans are divided amongst metal tiers, right, which help people shop. So there's gold plans, silver plans, bronze plans. And so those are kind of, they divide out how much the health insurance carrier pays and how much the consumer pays. So for a gold plan, it's an 80-20, that the carrier pays 80, consumer pays 20, down to a bronze, which is a 60-40 split, right? And Health Plan Finder offers a lot of shopping tools. So you can filter, you can sort, and you can do anonymous shopping just based on your zip code, and estimated income amount. So without providing any kind of upfront information for the application, you just get a general idea of what's in your area, what's offered, and drill down to what's important for you. We know folks shop on the basis of cost, on the basis of whether or not their doctor's covered in or out of network of a product, and then also on the coverage package, the benefits that are available. So those three key areas of shopping are made very easy through Health Plan Finder on the shopping pages, right?
Oh, fantastic. So just to clarify, for folks in the audience, it sounds like there are a couple of key groups that if they are part of, they might want to think about referring or themselves taking a look at the Health Plan Finder.
Right.
And so I heard one of them actually from Heidi might be your under 100 in size of employees, and if your organization doesn't currently offer for dependents and spouses coverage, that might be a great referral source for those employees. So that might be one. Is that right?
Yeah, and for employers, you know, I represent international companies, and I'm really glad sometimes that I live in Washington because our health exchange is pretty far along, more developed than a lot of other states. And for employers, it's been really helpful because we often have, you know, very valued employees who are long service. They're not eligible for Medicare yet. And we struggle, in the past have struggled to find health insurance for those people because, you know, they want to retire, but there was no individual market before this. So it's been great because we've been able to refer a lot of people to the exchange, and it takes care of the issue and creates jobs because then they actually do retire.
Oh, that's another great second group. I think a third group that we chatted about on our earlier planning call was perhaps one of your organization might have a lot of transitional employees or seasonal employees. Perhaps you have part-time employees. Would that also be the kind of groups that could take advantage of?
Absolutely.
Mm-hmm.
Yeah.
Mm-hmm. Just Nellie and or Heidi or Kelly, can we think of other sort of connecting the dots here that folks might be thinking, oh yeah, I didn't really think about the Health Plan Finder in that context?
So I would just add that we are building out our SHOP program, our Small Business Health Options program. This year, it's offered in Clark and Cowlitz County. Kaiser is the carrier that offers products in those counties. But when we look to, the next couple years evolving the marketplace, right? We're hoping to kind of get that more robust across the state. So I would add that facet to it, right? Because right now, small businesses up to 50 employees are eligible to come in, get a tax credit for small business health insurance. We're just not yet right to that stage where we've got it statewide, but we're getting there.
Yeah, and my employer clients that are small are really looking forward to that because in the past, if you had one catastrophic claim, it's really hard to get small group coverage.
No, that's a great point, Heidi. And so I think we're really looking. So keep an eye out for those of you who are part of, technically a small business organization. Keep an eye on SHOP, that acronym, okay? Lots of acronyms with the Affordable Care Act. I'm going to actually shift us for a moment here to Kelly. And Kelly, you have a great dual perspective. You're part of Group Health, which is not only a payer, but a provider organization as well. And then you've been a chief executive and executive roles for a provider group. In fact, let me just poll the audience. See a theme this morning? How many providers do we have out in our audience this morning? Oh, looks like we have maybe about 10 or so. Fantastic. Kelly, could you talk to us, not just for the providers in the audience, but for employers and employees, talk to us a little bit about payment reform and what the impact might be for any or all of those constituencies.
Sure. So it's been a really busy couple of years. So we do integrate both coverage and care, and we've got a lot of different initiatives and work that are going around under each one of those buckets. From the actual creation of new products that we're hitting onto the exchange, we've had people working very, very hard on the health plan side getting those ready. I will tell you from a provider perspective, it has been a non-event. Providers have dealt with for years and years and years multiple insurance cards, multiple coverage, multiple networks, and although we've seen a little blip in people calling and asking, it's from a provider perspective, it looks like just every other day, which I think is a great, great test to how well that it's worked out. So on the health plan side, we've been putting together, getting ready. On the delivery side, we've been getting ready to provide more value into the system. It really is about us becoming more affordable, continuing to offer that high quality care, great service that we've always done. But more and more and more, we've got to figure out a way to do that in the most effective manner. So we've been working on things like, how do we integrate care better? That's a big word for saying, when you go through your healthcare system, how is it the most effective? From soup to nuts, from start to end, how do we make sure that we're working together most effectively so you get the best service at the right time? So it's been a really exciting time. I think we have lots of opportunities, but we're still trying to figure out the sweet spot for integrating both the coverage and the care at the same time.
Great, thank you, Kelly. There we go, thank you, Kelly. Linda, you ready for your softball?
Yes. Remember, I'm just the replacement.
So, for me anyways, it's preaching to the choir that oral health is just an integral, foundational part of our overall physical health. But that's, I know, sometimes a tough message to get across to a lot of folks. Talk to us a little bit about just kind of setting the stage. Why should we care about dental coverage and dental health, oral health in general? But then, again, just like the questions to our other panelists, what is top of mind right now for this audience around dental benefits, dental coverage, and the impact of the Affordable Care Act?
Sure, thank you. Can you hear me? I'm not sure this is on. So I think as business leaders, you're all here today, and you really probably very well understand the importance of having a good benefit package to retain your employees and to attract new talent. In addition to just providing a healthy workforce and to keep your productivity as high as possible. Oral health, if oral health is not a part of that package, it will ultimately impact your overall healthcare cost. There was a study that was done recently in the University of Pennsylvania, and they found that by providing dental treatment to people with diabetes, hospitalizations were reduced by about 60% in the first year of treatment. So to put some dollars to that, it was about a savings of $3,200 per person on an annual basis. And again, this is for the connection between diabetes and oral health. Over time, per employees, these dollars add up, and they're significant dollars. So we have a very strong belief in that. In terms of just what is happening with dental on the exchange, I think most people know right now that currently on the exchange, it is only pediatric dental. So we have a very strong belief that adults are as important and that it is important to get adult coverage on the exchange. Off the exchange right now, the way that dental is working is it is embedded in a medical plan. But again, that is only for the dependents. So that's what's happening.
Great, thank you, Linda. I'm going to come back to Heidi and get ready for the glaze effect. No. So Heidi, I know you've been incredibly busy, not just the past couple of years, but especially January, a lot of things took effect. Talk to us about one or two, the client matters that you've been working on. What are one of the top one or two things that you've had to advise your clients on around all the changes with the Affordable Care Act?
Well, the last several years have been like Groundhog's Day over and over because we keep preparing for this mandate that's going to go into effect, and we start doing some calculations, and then it's on hold. So take a little breathing room. Last year, we were doing a lot of calculations about how we were going to track our full-time employees because the law assumes that we know who our full-time employees are and that it's easy to count. But a lot of my clients have variable hour employees, intermittent employees, seasonal employees, and really they don't know who their employees are day to day or looking back in the prior year. So there's two things to track. One, are we large? And the mandate was gonna go into effect this year. So we were calculating that last year to figure out, are we large? And we were calculating to figure out who are our full-time employees that we have to offer coverage to. then we stopped, and so now we're ramping back up again to do it now because it's going to go into effect in 2015. So the calculation that a lot of employers have to put in place now, if you are over 50 or you're over 100, is to figure out if you have variable hour employees, they come and go, and if you have seasonal employees, you can adopt a look-back period, which is this year for 2015, and calculate everyone and figure out how their hours averaged out. And if they average more than 30 hours per week in the prior look-back period, then you have to offer them coverage in your prospective stability period. And you get to choose what those periods are, and so a lot of my clients right now are figuring out, well, how long should the look-back period be? How long should the stability period be? Figuring that out. I'm expecting a cottage market to pop up to start tracking this stuff, like with payroll systems, but it hasn't happened yet. So I think I need to develop it, become rich, and stop this lawyer thing. But that's one of the main things going on, is trying to figure that out.
Okay, so calculation where you're going to trigger certain compliance. What's the second most common thing that folks are coming to you? I'm confused about X. Or, I'm worried about budgeting for 2015. When does X penalty or tax take? Talk to us a little bit about
So there's been a lot of, most health plans, employers would offer coverage at 40 hours per week or 32 or 35. Now it's full-time employees means 30 hours per week. So a lot of people have been looking at that going, well, I'm in the retail industry and people bounce all over. Some weeks they're 28, some weeks they're 32. Christmas is a big time period. So figuring that out, and one of the other things that I forgot to mention about these new regulations that came out on Monday is they said for 2015, you only have to cover 75% of your full-time employees. And so that is helpful for those companies that have the 32 requirement or 35-hour requirement to provide healthcare coverage, because that gives companies a little bit more time to figure out how do we reduce this down to 30 hours per week. And then in 2016, you'll have to cover 95% of your full-time employees.
critical issues for employers to think about. And I should have emphasized and mentioned at the beginning, and it's really clicking for me when Heidi talks. If you have questions, be sure to write them down. There should be notepads or note cards on your tables, and we'll have GSI folks going around collecting those, and we'll be bringing those up to me so we can ask our panelists. So be sure to, if you've got those questions, write them down so that we can have those for our panelists. Great, thank you, Heidi. Let's shift gears just a little bit here and talk a little bit about prevention and wellness, because in theory, one of the big ideas and behind having the Affordable Care Act was to shift our focus as a healthcare community, as a nation, towards not just the treatment end of the life cycle, but let's go upstream to prevention and wellness. So I'm actually going to ask Kelly to start off here, and from, again, the many multiple hats that you wear, talk to us about what you're seeing in terms of whether it's, employer-based wellness plans or just your own organization. What are you seeing around prevention and wellness that our audience should be thinking about and should be intrigued by?
Sure. So from the employer and the health plan side, there's a couple trends that we are seeing, which is the continued development of employee wellness programs. And I think one of the things that we are finding is that you can make this any way that you want it to be. Heidi and I were just talking about that. From employers that have 5 to 500, and we are finding that employee wellness programs are being successful. Like all things, we can overcomplicate them. Heidi was just telling me she has a client, it was a 20-page document on their employee wellness program, and that probably was the exercise, just getting through the document. But
yeah. I had the task of figuring out whether it was legal.
Yeah. But we're seeing a couple trends, and people and folks are really loving it, employees too. The main thing that we're seeing coming out of employee wellness programs is a decrease of premiums or the ability to buy better health plans, so lower deductibles, better co-pays. We're seeing folks doing anything from just health risk questionnaires, just kind of employee engagement at the beginning, all the way up to full biometric screening and folks getting incentives initiatives to improve their actual outcomes. So there's lots of opportunity, I think, in that area. There's lots of vendors out there that are helping, and health plans and group health specifically are working really hard on that. I think the second thing on the coverage side that we're also noticing is this new kind of term of value-based benefit designs. We've always been kind of working with benefit designs, lowering copays for preventative, higher copays for ER, but we're starting to see people get a little bit, add a little finesse. So lowering copays or no copays for things that are always treatments, things that we know improve health, immunizations or statins or medications that are a part of a normal routine for chronic disease that we know the outcomes are there and will lower the overall cost. So we're starting to see employers get a little bit more savvy about how they worked on value-based benefit designs. On the delivery side, or the physician side, we are continuing to focus on what we call medical home implementation. So, which really focuses on prevention, and it focuses on patients having a place to go. It's all about your primary care physician, and they're managing your care through the continuum, working on that prevention and being an opportunity or an access point for patients. So I think we're hitting it from all different sides, but it absolutely is becoming more and more important as we all work to lower the costs overall.
Fantastic. Thank you, Kelly. Nellie, I'm going to pick on you next. And especially for our audience that may not be aware sort of nationally and overall some of the new requirements that the ACA put into effect that do impact, try to go upstream, if you will, around wellness and prevention. Talk to us a little bit, because when folks end up, or some of our employees, spouses or dependents and or part-time workers or friends and families that currently have access or coverage end up using the Health Plan Finder, what's different than, say, a couple years ago that will help promote wellness and prevention?
Yeah, sure. So I think there's three areas that kind of Health Plan Finder and then the Affordable Care Act kind of touches on this prevention and wellness. So one is a baseline that the Affordable Care Act put forward on these new qualified health plans that are offered on the exchanges. So all qualified health plans have to cover the 10 essential health benefits, one of those being prevention services. So annual visits are covered, and maternity care is one of these essential health benefits, right? So all of the plans that are offered on Health Plan Finder meet those requirements and fall into those categories of benefits, right? The other point is, consumer information, right? Health Plan Finder, as the tool to shop and kind of compare the products, has a variety of tools. One is a filter to find out whether or not a plan is HSA eligible. So, kind of those higher deductible plans that then kind of offer folks the ability to put away some money to, whether it's out-of-pocket cost sharing on visits because they're managing a health condition or they're healthy and they just need to kind of use visits for prevention. And there's also on our Compare Plans screen an ability to see what the kind of actuarial value of the plan plays out for a health condition, such as having a baby or managing type 2 diabetes. So you can really kind of see over the kind of implementation, the individualization of how you would use the product is kind of on average played out on screen. You can see across up to 3 products what that looks like. So, kind of with those major areas, Health Plan Finder touches on this, prevention and wellness.
And I'll just jump in
I was
on
going to
wellness
say,
programs.
please jump in.
A lot of my clients have had a very good success with implementing wellness programs and bringing down their healthcare costs, their insurance costs. Some of you may have heard some comments from the AOL CEO last week. He made a comment about healthcare costs and called out 2 claims. There were 2 of his employees had premature babies. Talk about picking on one of the most sympathetic people in the world. And he called that out as the expensive part of healthcare coverage, and that's actually those one-time incidents are really not the cost. All the costs, and the data will show this over and over, are things that were a result of lifestyle choices, type 2 diabetes, hypertension, that data is out there. And so employers who are really trying to lower their costs are not going after the premature babies. They're looking at ways we can support you with your diabetes management or your hypertension and incentivizing people. I have one client who found out their population with diabetes, they weren't managing it because those little strips are so expensive. So they said, we're going to cover all your strips. You can always check your diabetes for free. And a lot of people got their diabetes under management with that.
I think those are two really incredibly important points, which is whether it's the AOL CEO making that mistake or the rest of us, which is we tend to remember those one-time, memorable health incidents as opposed to the data showing that really it's about these longer-term and that's really where the cost is coming from. And I love that example that you just gave of one of your clients who said, wow, if I think more holistically about this, I can net ahead financially if I help my employees with their wellness. And sort of the old adage, what's the old adage? Go ahead and say it out loud. What's the old adage?
An ounce of prevention is worth a...
Right, an ounce of prevention is worth that pound of cure. So that's a fantastic example. Heidi, do you have maybe one or two other examples where either a client or you've seen a case study where there's been kind of a cool innovation or some unusual thinking around employee wellness?
There's a lot of them. I think people are really trying to think outside the box. Wellness programs started as a health risk assessment and biometric screening, and a lot of people, and they would offer you $100 if you did it, and a lot of people found the $100 wasn't really a big incentive, and it really only told us what we know. You found out you're overweight. Well, guess what? I already knew that. So employees weren't that receptive to them. What people have been really receptive to is small things like having healthy snacks available in the office. You have a basket of apples or fruit, those sorts of things that are free. Having a lot of us, I'll use my own firm, they decided that we'd have these Weight Watchers groups in our office, and everyone at first thought, well, that's kind of awkward, but people got really into it, and there was this camaraderie around it, and a lot of people have lost weight. We started a walking group, and so in the cold winter, there's a group that walks through our garage in the basement in the morning, and those sort of things have just been, people are receptive to it. There's no $100 associated with it, but it's actually changing something.
Oh, those are fantastic examples, and it's great that it's from your own firm, and here you are, and a benefits expert on the legal side in a law firm that has this practice. So I love there's the other adage, right? Let's practice what you preach / set the role model. So I think that's fantastic. I'm wondering, I'm going to put Kelly on the spot here, since you are a part of a healthcare delivery sector organization at multiple levels, right? Provider through payer. Any cool examples of some innovative, and you've been an amazing innovative group health. In case you don't know it, group health has a national reputation around the medical home model, and just fantastic innovations there. So any examples from your organization?
As we were just talking, I started thinking about my husband last year, because it's for dependents also, obsessively tracking his total health points. And we had a system online, and it goes back to what incentivizes you. I would ignore it, and he would have to remind me that's not what incentivizes me. Shoes, maybe that would be good. But clicking the button and saying, yes, I did go soda-free on Sunday, and I did walk this many miles this week, and I did drink this much water. There's multiple choices that they've done a really good job with. That was really fun and really exciting, and posting comments online with other people doing the same thing. So yeah, we've been doing some very innovative things. This year, interestingly enough, group health is actually moving to the next level. We've been doing it long enough that kind of the tracking, so we're working with vendors called Red Brick and others to really start getting even more incentive around that. Our incentive on the back end is off our premium. That helps cover part of your premium, which is a really big deal, and it's a great way, I think, to incorporate what we're doing and putting it all together. So,
oh, fantastic.
I can just comment on wellness on dental
Yeah,
as
please.
well. So I think With dental, I think everybody pretty much knows that there are very limited categories, decay and gum disease. So we have really always focused on prevention. It's a very big part of the plan design for dental plans, and typically they're not subject to deductibles, not subject to annual maxes, and so we really encourage people to go in for their preventive services. Some new plan designs that are starting to emerge are even having those preventive services not go against your annual max. So anything we can do to get people to go in and get their prevention. Another thing that we're really encouraging folks is that people that have wellness packages or programs, make sure to include dental in those thoughts. So if you have a risk appraisal, ask a few dental questions. Make sure that you have that in the forefront. We have some companies that we work with where they have some incentive. If you go in and get your annual physical, there's even a $1 reward. We're now saying, you know, if they get their 2 cleanings per year, please include that in your incentive program. So that's a big push that we're making.
Or you could leave out on the lunchroom table for the employees toothbrushes in the center of the table.
Absolutely, yes. Feel free to take those
We
today.
got rid of our soda machines.
Well, no, I think that's another excellent example of, you know, how do we shape our working environments to support, I mean, especially we're just coming off January. Just quick poll here. How many folks made a New Year resolution somehow related to health this year? Yeah, a lot of us, right? So wouldn't it be great if our work environment, you weren't being tempted by that plate of fresh baked cookies left by, you know, that well-meaning whoever at the lunchroom that morning. So yeah, no, I think there's a lot of very cool ideas here that hopefully can inspire some of you about how can we shape our working environments to better support our health. Another couple quick questions. Do we have folks in the audience, you're part of an organization that is self-insured? Can you raise your hands? Keep your hands up. Quite a number. So, you know, I would hope and or presume, and Heidi, maybe you have some experience on this at all. I'm not sure about your client base, but that clients with
Large employers are self-insured.
yeah, that you would have even more direct incentive to help your employees be the healthiest that they can be.
Yes,
Yeah.
absolutely.
Okay. Fantastic.
Gym
All
club
right.
memberships are also very popular.
Yes.
Say that again louder.
Gym club memberships, also very popular with employees and shown to be effective. We'll cover your gym membership, just prove you're using it.
You know, I was chatting with one executive here in the region, and it was a fairly small organization, so it wasn't a huge hit to the bottom line. But basically, and I'll do my theme this morning, raise your hand if you or a family member or a coworker has a Fitbit or something similar. If you even know what that is. Wow, okay, look at that. I mean, that's, so anyway, so this particular person was basically saying, yeah, I'm buying my whole team Fitbits. And, you know, for me, it's been totally cool. I'm constantly checking how many steps I had this, you know, up till now. And so I'm getting this for my whole team. Have you seen anything along those lines?
I actually have a lot of clients that have given their employees Fitbits. Primera has a program too where they've encouraged it for their, Primera does a lot of the administration for self-insured plans. So there's a whole program around the Fitbit that they've offered as well. And employees really like that. And again, it's one of those camaraderie things where then people start comparing with each other. How are you doing?
That's cool. Just curiosity, any of your organizations doing anything like that, whether a Fitbit or gym membership? Just raise your hand if there's, you know, some sort of unusual incentive. That's awesome. Let's see. Spokane, we're leading the way here. All right, I'm going to shift us here to another set of topics, and that's about what's the road ahead. And so maybe I can start with Nellie. And what's coming? You know, what's coming for the exchange? What's coming nationally from your perspective that our audience, especially, let's set an actual metric, 2015. So we talked a lot about what's happening right now that we should care about right now. 2015, when we're turning to whether budget season in third, fourth quarters or whatever, what should we keep an eye out for in 2015?
Great. So I think in part a condition of our environment, of the ever-changing landscape, right, which has now brought us to this new world of healthcare in 2014, has really allowed the Health Benefit Exchange to kind of become an organization that knows we're always going to be evolving. So this, as our first open enrollment period, October 1st through the end of March, we're learning so much, and we will be taking time to kind of evaluate. And then so we're ready for the next open enrollment period for coverage that's effective in 2015. A lot of that evaluation will shape and change the shopping tools. So according to what consumers are using and what is successful in getting them to a plan that fits their needs, Health Plan Finder will continue to change according to the consumer demands, right? In terms of developing the SHOP program, the small business program, this next year is key for us to really get more carrier participation, and really hopefully a carrier that'll offer a product statewide. Our board, as well as just stakeholders who are involved in shaping what this new marketplace looks like, we've heard that there's a demand for this small business option. So we're really encouraged by that, and we want to keep continuing to grow those conversations, to shape them, so that we can have a more robust market for small business, and then also for individual, right? So we're about to start doing we work closely with the Office of the Insurance Commissioner, who does the rate review as well as the benefit review for all the products that are offered on Health Plan Finder. So in about the spring time frame, we're looking at getting into that so we know what the products look like for 2015.
Great. So is there a particular date that folks should say, oh yeah, I remember I went to that panel and what's going on with the Health Plan Finder or SHOP? Could my organization perhaps find a new plan on the SHOP? Is there a particular date they should keep in mind?
Yeah, so about the June or July timeframe is where you'll hear about what these new products look like for 2015 coverage.
So fantastic. And tell us again what the profile, so if I'm an organization of X profile, let me go check in June to see what the developments are.
So the profile, sorry, I didn't quite understand.
The size or type of business?
So it'll be up to 50 employees, right? So the small business part of the exchange extends up to 100 employees eligible in 2016. So for this time frame, for the 2015 coverage, we're still looking at those up to 50 employees.
All right, so just to recap, so if you're part of an organization that's up to 50 right now, although you'll need to consult Heidi to calculate that.
I'm an attorney that does math.
Wow. I thought they were all, poli-sci majors to start with. And as you heard from my bio, I am a reformed attorney. Yes, my name is Anthony. So if you are 50 in June, July, be sure to check in with what's going on with SHOP to see if there's some available options for your organization in this region. Is that right? Okay, great. But then keep an eye out if you're up to about 100 in 2016, again, so probably in June, July of next 2015,
That's
you should pay attention. Okay, great, that's fantastic. On the oral health side?
On the dental front, so 2015, inside the exchange, I understand there will be no changes. So essentially, adult dental will not be offered inside the exchange. Good news is in 2015, outside the exchange, we're able to either partner with a medical carrier or offer standalone dental outside the exchange. So we're happy about that. You may have heard the conversation about reasonable assurance. So what needs to happen is that we need to be able to, or employers need to be able to support the fact that they have the pediatric dental component covered in their dental plan. So there will be a process, I understand that it's in the rulemaking order as we speak, where potentially the client would do some kind of attestation that they have pediatric oral coverage, and we may be giving them some kind of certificate of coverage or something to support that. So that's new and different for 2015, so we're excited about that. We're very interested in the shop, and thank you, Nellie, for the update on that. So we'll be following that very closely as well.
Great. Thank you, Linda. All right, Kelly,
Yeah.
from your perspective,
One word.
2015.
One word, affordability. It's my little mantra, and I keep saying it, but there's just no more money in the system. And so we have to figure out the best way to most effectively provide all these services at an affordable price, or we won't have access. So we're going to be continuing to focus on affordability.
Fantastic. All right, Heidi, you get to close us out.
What's on the horizon?
What's on the horizon?
I think
Which
after-
clients are you saying, look, you better call me in August because you better be worried about X? Go ahead.
Well, I think those employers that want to use the look-back period with the calculations of full-time employees need to start doing those calculations now. Some of us started doing them in 2013, went on pause, and need to be tracking hours and things now. But I think on the horizon, after we get past the initial headaches and heartburn, that there's a lot of innovation going on right now, and because it's just more top of the mind with this out there. I'm working with a startup company right now that their target market is employers under 50. What they are doing is they're the founders of a very large staffing company that decided to start a new business to represent small employers. But rather than being a staffing company that leases workers to you, they're going to outsource payroll and provide benefits. So right now I'm working with them on the startup process and the process of getting carriers to issue them policies that will then cover their employer clients that are all unrelated. It's a tricky little legal scheme, but I think in the market it will be great for small employers.
Fantastic. All right. I was going to ask a couple more questions, but I just got handed this stack. I'm like, let's see. We have basically about 32 seconds by my calculation for each of these questions. So I am actually going to go ahead and go right to the questions that all of you out there have posed to our great panelists. And so I don't see a lot of names on these so far in the first couple, so I'm going to rely in some small part here or a large part on each of our panelists to kind of just go ahead and not be shy and jump right in on some of these questions here. Okay. So for our first question, asking to review the trends in the cost changes for employers and or insured, meaning I guess to the extent that you may be self-insured, since the inception of the ACA versus what was anticipated. And I don't know, Nellie, if you might have some general trend data. Have we, especially in Washington State or in this region in particular, have the cost trends been higher than anticipated with the ACA? Have they been about on target or lower? I don't know if you have any.
Yeah, so I can speak to it from, I would first say that kind of the resource, right, for that information for our state is the Office of the Insurance Commissioner, right? So all of the plan filings go through their office. But when the plan filings, and this is, my answer is broad, right? It's across individual and small business markets. So plan filings for the coverage year 2014 last year, in 11 states, HHS did an evaluation to kind of see, how is the exchange market kind of shaking out, and they were seeing a 3% decrease from the prior year in rates. So that's, it's a positive downward trend, right? And that's, specific to these products being offered on the exchanges, right?
Okay, well, that's definitely intriguing. Kelly, I mean, you have a payer hat, so you probably, at least for your organization, have some data for the last couple of years in terms of the trends.
Yeah, 2013 was actually historically low trends across all carriers.
Really?
Yeah.
Wow.
And we're expecting the same probably about for 2014. We're kind of going in about where we were last year. But yeah, it was actually generally lower historic trends than has ever been in a while.
And lower than was anticipated when the ACA was first passed, or about on target for this hoped-for savings in terms of bending the cost curve?
I don't know if I can link it to ACA projections, but
Okay.
I think it's just general trends across all carriers are down.
Okay. Well, that's, like I said, surprising and fantastic news that the cost curve seems to be bending, but of course we'll wait to see if the prediction for the continuing lowering of the bending of the cost curve continues. And I don't know, Heidi, if you've seen anything from your clients or heard anything. If you haven't,
No.
it may not be you're calculating other things other than the cost trends. Okay, fantastic. But I think I do have a question for you here. What are the tax incentives available to companies?
Tax incentives for offering health insurance coverage?
That is what the question says. So you can make it whatever you want, or some really bold person who wrote this can
we've
yell
really-
out what they meant.
We've really been focusing on sticks rather than carrots, but I mean, it's deductible, that it's a business expense, but that's always been the case. Right now, it's really about the penalty and avoiding that penalty.
So if you want to think of avoiding the penalty as an incentive.
Yes.
Yeah. Can you,
Because you definitely want to avoid the
okay.
penalty if you're
Right. So and can you just quickly recap the 2 or 3, okay, these are the tax penalty or hits that you'll get if you don't do X, Y, Z, just really
Well,
quickly.
there's 1 or 2 penalties. We call them the A penalty or the B penalty. The first penalty is pretty severe. It's if you do not offer coverage to all your full-time employees, even if you just miss, well, now they've come out with rules. If you miss 25%, that's okay next year. If you miss 5% after that, it's okay. But so if you miscalculate and you get something wrong and you're not covering all your full-time, or at least offering all your full-time employee coverage, you're going to get hit with a penalty that's $2,000 times all your full-time employees, even though you are offering coverage too. So do the math on that one and you see that that gets pretty steep pretty quick. The B penalty is if you offer coverage, but it's not affordable. And some of my clients have looked at their workforce of low-wage earners and just said, there's no way to make it affordable with what we have to offer in a plan. Limited indemnity plans are pretty much out. So we're going to choose to pay this penalty because we just can't make it affordable. But the penalty for the B penalty is reduced, and it's only multiplied by the number of your employees who actually get subsidies on the exchange. So a little bit lesser penalty. But some people are doing the math and just deciding that's what we're going to have.
If we can attract both those who are young and healthy, as well as those who maybe by natural ways are seeking health insurance, right? Because they're trying to cover a condition, they're sick. It's just kind of, right? This is the business of health insurance. So the plans that Health Plan Finder has to attract those young invincibles, those 20, 30-somethings. We recently started a campaign working with Live Nation, which is a concert as well as music company, right, in Washington State. Live Nation actually runs the Sasquatch Music Festival that occurs here in Eastern Washington in the Gorge over the summertime, and we're running a sweepstakes, knowing that a lot of the folks who go to those concerts and are attracted to those venues are of this target population. So the sweepstakes is tickets to that Sasquatch Music Festival. We're about to launch some new ads that you'll see in the next week or so, which are specifically targeting this population, kind of all wrapped up around this partnership with Live Nation. There's also a lot of effort to do outreach through social media channels. So we've got heavy presence on Facebook, on Twitter. The last data report does show that about 12% of our enrolled population is this young invincible group. So we're happy with kind of where we are in those enrollment numbers to date. But we know we have goals ahead to continue to attract those folks to cover and kind of equalize out this risk pool, right?
Fantastic. Thank you, Nellie. It sounds like you
Nancy?
have some. Yeah, go ahead.
I just remembered, there is a tax incentive for very small employees
Go.
that offer. It's like,
Whoever asked
that's
that
back there
question is
somewhere.
perking
There-
right up.
There is a tax incentive for very small employers for offering coverage, and I don't remember, maybe someone in the audience does, that where it phases in out, but it's dependent on your employee's income and how small you are, and it's a gradual.
There's a press release on the Insurance Commissioner's website.
Oh.
If for those of you who didn't hear that, repeat that on the
There's a
mic.
press release on the Insurance Commissioner's website for that, so, thank you.
So go check out the Insurance Commissioner's website. Thank you for that. And this next question probably actually is best for you again. There's a reason why you've been asked for a fourth time to come back to us. And it sounds like this is being asked by a business owner or a principal, and basically asking about a strategy. If I'm going to cross the 100 or the 50 person threshold, is there a strategy to essentially not trigger some of these things by using, for example, an employment agency, third party, or some other technique, essentially some workaround to avoid triggering that, or essentially, at the end of the day, am I still going to be subject to these because the employment agency themselves will be subject to it, and so they'll pass on those costs to me anyways. Can you talk a little bit? Have you advised your clients on that?
Yeah, absolutely. I mean, there is some concern that people will only hire part-time workers to avoid being subject to the mandate. There is more use of staffing companies. I represent a few very large staffing companies, and we've lobbied with them in Washington, D.C. to address how this works if you are either an employer using a staffing company or you are the staffing company who's responsible for paying the employee. So we asked them for specific rules for staffing companies, and they said they're receptive to it because staffing companies do keep people employed and create jobs. And they're receptive to it, and they came out with some guidance, but the regulations that came out Monday said, we're not going to give you a special rule, but we are going to recognize that if you are an employer using a staffing company, if the staffing company is providing the health insurance coverage, we will consider you to have offered the coverage. So you're complying with the mandate there. The caveat, though, that I didn't like was that they said, only if the staffing company is charging you more than they would if you weren't providing coverage through them. So there will be a pass on an increase, but whether that's more than what you would pay getting coverage on your own as a smaller employer, who knows?
So more calculations. So in essence, it's not a slam dunk. It's not, I can definitely go this route as a workaround because you're going to have to end up doing the math between the staffing company having these higher costs.
And there is a lot in the new regulations about if you are subject to the mandate for the first time and special rules on that. Like I said, haven't memorized them all quite yet, but.
So whoever asked this question, it sounds it may be worth a modest investment in some specific expertise and counsel on this question. There's quite a bit to get through there. I've got a nice softball question for Nellie. What is the URL?
This is important, actually. It's very important. wahealthplanfinder.org.
Say that one more time, so whoever's scribbling down that answer.
It's wahealthplanfinder.org.
Or what would be an easy search engine search that would hit it?
You can type in the Washington Health Benefit Exchange. You just want to make sure the website you get to says it's the official ACA compliant health benefit exchange.
Okay, go with the first one. No.
Yeah.
There are a lot of private exchanges popping up that you got to wonder what the products are being offered.
Okay, so just realize if you use a search engine, there may be other exchange sites that are not the Washington Health Plan Finder site. Okay, that's great. So got a question for Kelly. Network contracting with hospitals, purchasing and provider groups are now billing for outpatient services in doctor offices. What assurances are in place to keep costs at prior levels or lower?
Right, good question. And we are seeing that happen in the community as hospitals purchase medical groups. They are under their hospital contracts, and we are seeing costs come through that the week before cost about half as much. So we're going about this in a couple ways. One is just directly around our contracting. We're making sure we're working with our partners around monitoring that a little bit and doing some contracting. I will have to say that the groups in town that this has impacted are also working very hard on trying to take care of that. They're working on putting things into the outpatient setting that they weren't doing before, and we're really trying to work together to narrow down so those costs are not in the system that have just been added in because of these. So not sure that there's a direct commitment, but there is a lot of work on trying to minimize that impact.
Fantastic.
Yeah.
Thank you, Kelly. So I will put this out there to whoever might be able to answer it, and it's essentially a question, maybe another math question here. Someone trying to figure out the cost benefit. So it's about our wellness discussion and wondering if there's any data about the ROI, right? The return on investment. So if I spend XYZ on my wellness program, can I expect to see a percentage reduction in my healthcare costs if I'm self-insured, or can I expect a certain percentage reduction in my overall premiums because I'm now, creating better results?
There's actually a lot of data on that. The Kaiser Foundation has a great website with a lot of graphs and historical trends that they have a lot that they allow you to use. So I have a lot of their slides in some of my presentations, but it's really eye-opening to look at some of their reports and statistics because they do prove their return on investment for them.
So fantastic. So the adage about the ounce of prevention is worth the pound of cure. The Kaiser Foundation has a website with data demonstrating empirically that that's actually the case for companies. Fantastic. Thank you for that resource.
Yeah.
Okay, I'm going to read this one here. What has been the carrier objection, reluctance to engage in the shop plans on the state exchange? I think we know who should answer that question. Ellen.
That's a great question. So I think it's, a product of all this being new. So we did have Kaiser, as I mentioned, and Clark and Cowlitz participating. And they were kind of, the carrier that kind of put themselves out there to kind of run this pilot of SHOP. It's an interesting comparison of how SHOP kind of played out versus our individual market. We got over 9 carriers participating in the individual market. So that's kind of, an area where we can kind of use as a baseline right now to compare then against how we want to develop and grow SHOP. So I think carriers, made their own actuarial analysis, kind of looked at, what's new and what the risk is out there. And, that's what I can kind of say to that. We want to grow it. So we will see what 2015 brings.
Is there anything in particular that stakeholders in this region can do to be supportive of having carriers or payers provide that kind of coverage on the SHOP exchange?
Yes, definitely. So we have a governance structure, right, that stems out from our board. We have several technical advisory committees that always have a period of public comment. So one of those technical advisory committees is our SHOP program. And you can find the information for when that group meets on our corporate website, which that hyperlink is wahbexchange.org. And under committees, you can find when that SHOP technical advisory committee is meeting. So we welcome public feedback. The staff kind of works the public comments we get, takes it to our board, and our board is the decision-making body, right, for the, the products that are offered on the exchange.
Fantastic. So for those of you who do care about this issue, there's an avenue, like most, here we are in a democratic society, right? If you care about an issue, write your congressperson, write your state senator, and in this case, if you care about the SHOP exchange, there is an avenue for you to provide your input. Fantastic. So we have a question for Linda and the whole panel, but for Linda to start off with, any innovation about how to further integrate dental into overall healthcare plans and HPE for adults?
Well, I think one of the things that we're just working hard on is the education factor about the adult dental coverage and the importance of it. Here in the state of Washington, as an example, for Medicaid folks, dental was pulled out a year or two ago. And effective January 1 of this year, the legislature put dental back in for the Medicaid patients, and that impacts about 700,000 people in the state of Washington. So we see that as a very progressive, a very good step. So we will continue to just have the conversations about the importance of adult dental, trying to get that on the exchange. Again, happy in 2015 that we will be able to have off the exchange some different options and programs.
Fantastic. Any additional nuances anyone want to add on that?
I would add that our board for the Health Benefit Exchange has brought up adult dental as a future policy directive. So, at this time, it's looking like a 2016 timeframe where adult dental products would be offered through Washington Health Plan Finder.
Yeah, no, that's good to know. So I got a question for Heidi here. Hopefully it's a pretty fast one, but if this morning's experience is any indication, it's probably not a quick answer.
Come on, lawyers can't keep it short.
Absolutely. I'm just as guilty of that. So the question is, are government agencies and nonprofits exempt from the ACA, or do they also have to comply with
They have
the
to comply.
Look at that. You saw it right here. An expert attorney in 3 words answered the question. I'm teasing because I've many times been accused of being way too verbose. Okay, here's another one for you. Any change in how to calculate 50 plus versus 50 under?
Some changes in the regulations that came out Monday allow you to change the time period in which you're calculating the 50 and under if you are new or close to the cusp. These are new, so I haven't had a chance to memorize them, but it's really a calculation looking at FTEs and averaging whether or not you have 50 full-time equivalents. It's not bodies, it's hours worked and calculating how many averaged out to being more than 30 hours a week in the prior year.
Great, and then actually it's interesting, there's a follow-up question and totally in different handwriting, so I know it's not the same person, asking just from a policy point of view, / impact on the ground about the 50 limit, and kind of a question about, are we accidentally encouraging employers to stay below these trigger numbers? Couldn't we have a policy change to perhaps have a gradual phase in so that if I'm hiring 10 more people because my business is doing well, I'm not sort of counter incentive to, do some of these other things and that type of thing. Has that come up for your clients?
It has come up for some clients. I know it's raised by our lobbyist in DC quite a bit about, is there a negative consequence here of creating more of a part-time workforce? It might make too much sense to transition it in though.
So from your lobbyist point of view for the firm, he or she would probably advocate, hey, let's get some compromise going at the federal level, and let's make some improvements to some of these things.
Yeah. There's actually a lot of reception in Washington, D.C. to some of the questions about, job creation and what do we do with this. When we lobbied with the staffing industry, that was a big issue. They've put a lot of people to work, and if you're going to impose such a penalty that it puts the industry out of business, that's not exactly going to work. So a lot of these things have been brought up. The changing full-time definition from 30 to 40 is another potential issue that's out there because a lot of people are at that 35 to 30 mark. So we'll see what they do.
And we have just a couple minutes here before I have to wrap us up. One person is asking, why can't we all have an HSA regardless of the type of insurance plan we have?
It's a good question. That's part of an HSA is a health savings account, if you don't know. And to have a health savings account, you have to have high deductible health coverage. And there is a lot of, it makes a lot of sense. A health savings account would help us all save for health care in retirement because it's not one of those use or lose it plans. But it's, right now the policy reason behind it is you have to have a high deductible health plan to have the health savings account. But that would be a positive change, I think, if they change that. If you could have a non-high deductible health plan and still have your health savings account, which grows tax-free.
Wow, we're having a slew of Heidi questions here, and the pace continues. So for folks who are that have individual friends or family that are searching for jobs and they're using a staffing agency, just a question to clarify: could they get coverage through that staffing agency because of the new requirements? And how are they being treated?
Yeah, I think the American Staffing Association has encouraged, and as an industry, that they are going to be offering coverage to the employees that they place with their clients. So I think that's going to be a good option for a lot of companies too.
Okay, fantastic. And then I love the sort of commentary here is they might be asking an unfair question. So Heidi, this is not a softball question. They're wondering what % of the ACA is fairly well defined and understood versus yet to be issued regulations, and who knows what's going to happen
don't shoot
there.
the messenger. Last year when I gave this presentation, I said, I'd been keeping track of all the healthcare reform legislation in my office, and I'd had it in a neat pile, and it was getting to be about as tall as I am. Granted, I'm only 5 foot tall, so it's not a high mark. But now I'm adding on to that. There was another stack on Monday this high. There's so much in it that is ambiguous because it really does assume a very, traditional workforce. We all know this is not 1950, and workforces look very different and non-traditional, and so there's a lot of that. The regulations that came out Monday did say, we're going to give you more guidance pretty soon on how you do your tax reporting, because eventually we're going to have to report to the IRS the kind of health care benefits we provide.
Fantastic. And I did my best to power through. Not only did I save some of the time from extra questions that I had pre-prepared, but I tried to power through as many questions as I could and didn't quite get through all of them. I hope, could you please join me in giving a very warm thank you and appreciation to our panelists.
Yeah, wow. The great thing about my role this morning is I get to come up and down the stairs several times. Those are Fitbit walks, people, and I'm not going to exploit that by walking up and down this. But if you see my wife today, please tell her I'm trying, okay? Okay, again, one more time for Kelly and Heidi and Nellie and Anthony and Linda for a great, great presentation. Thanks again to our presenting sponsors, Group Health and Delta Dental of Washington, to our supporting sponsors, Gonzaga University's MBA program in Healthcare Management and the Community Colleges of Spokane, to our event sponsors, Inland Northwest Health Services Community Wellness, Pathology Associates Medical Laboratories, and Providence Healthcare. Here's my airline attendant thing. We've got folks here who can answer your questions afterwards. We've got Journal of Business special reports in the back as you leave. One last set of instructions, and that is to please go out and have a great day. We are adjourned.